Hi, we've been asked if patients with headaches should be seen under urgent or essential eye care services. The answer is generally no, as most patients with headaches will be able to wait until this public health crisis is over. If the patient has a very severe headache that's sudden onset, then you should carefully consider whether it might be better actually to direct them to eye casualty, particularly if they're having associated symptoms such as double vision. And in that case, they should not come down and see you, but you should give them the appropriate details of the hospital eye service that they can access. Well, it's up to your professional judgment as to whether you wish to see these patients, but really it can be informed an awful lot by your telephone triage. So ask them hard about symptoms that they're getting. Are they in a high risk group of retinal detachment? Have they had recent intraocular surgery? Are they really high minus? Have they had a blow to the eye? And so on. If they're clearly seeing a veil or a curtain in their sight, then really there's no point in you seeing them. You should send them straight off to eye casualty. Otherwise, it's really up to your professional judgment. But you might consider that if they're only noticing a few floaters or a few flashes, that's something they can monitor at home and contact you if the situation worsens. Thank you and take care.
This requires a bit of creativity and it depends on the individual shape and structure of your practice. In the waiting area, you may wish to separate the chairs, use masking tape on the floor to ensure people are standing certain distances apart, ensure your reception team is sat much further back from reception desk than they normally would. In the consulting room, you'll want to do all of your case history and symptoms beforehand, virtually if possible, and then when you're talking to the patient, you want to be at the far end of the consulting room and ideally with a window open if that's possible. You'll then, when you need to do investigations where you get closer, if you do have access to a mask, you can then don up. If you don't, you simply go in, you don't talk at the slit lamp, you do the necessary investigations fully, properly, but with brevity, and then move back away to sum up your findings afterwards. So a question has just come in, where would I stand legally if I missed out one of the tests that would normally be considered essential, such as IOPs? Well, the first thing is you shouldn't be completing routine examinations on asymptomatic individuals anymore. You really need to be focusing your consultation on the symptoms and doing what you need to do to make a decision to ensure the person is not going to suffer from sight loss and that they can see. You should mark your record card with COVID-19 so it's clear that anyone assessing the records in the future will know that you're operating in a slightly unusual or a very unusual situation, and the GOC has made very clear that they would take that into account if there ever was a situation where your consultation was called into scrutiny.
We've had a query from a member who is in a vulnerable group and so is unable to see patients. And the query was whether they can amend the poster to say that they're able to provide a postal service for patients, but they're not actually seeing patients. Well, the answer to that is, of course, yes. We provided the poster to make it easy for practitioners to make it clear to their patients that they will still open for business, albeit on a very limited basis. But if you want to change the poster or amend something different, then that's entirely up to you.
So we've had a question come in about whether you can dispense or repair glasses and how you should go about doing that in this situation. Well, if it's a dispense for a lost or pair or broken pair of glasses, then we've set up a telephone review form that you can complete, and you can do that over the phone, and then if you're happy you can then post out the spectacles and get the child to come back in after the crisis to have the glasses fitted. If it's a repair that you need to complete in person, then you need to use your professional judgment. Are there any other pairs they can use? But if need be, they may need to come in and you'll need to just manage that situation as safely and as best as you can.